to, and the vaccine news is very promising. Another piece of good news is that while this virus is spreading in Virginia, we remain near the bottom of states for the rate of new cases, and this is good news. So let's look at this chart from the New York Times. And it's kind of a busy chart, but this is ranking of states with cases going up. You'll see we're fourth from the lowest. The only places doing better than Virginia are the islands or extremely cold rural states. So this news is good for Virginia because, as you have probably seen on the national news, the COVID pandemic is surging across our nation. Case counts, hospitalizations, and deaths are rising dramatically. We do not want to see the situation here in Virginia get worse. So while we're doing well compared to other states, we are also seeing greater spread of this virus. We recorded 2,071 new cases yesterday and 25 additional deaths. The day prior, there were 29 deaths reported. We're seeing a record number of daily cases recorded this week. As you can see on this slide, we are doing thousands of tests a day. Our percent positivity has tipped just past 7% this week. Just a few weeks ago, it was 5%. The most rapid and concerning spread remains in the Southwest region, but all of our regions are seeing increases. And you can see that hospitalizations are going up. I do not intend to wait for things to get worse before taking action. That is why we have put new mitigation measures in place to help slow the spread of this virus. These mitigation measures apply statewide because we need them in every region. We don't want to wait until we're seeing overwhelmed hospitals and double-digit positivity rates in every region. Social gatherings must be 25 people or fewer, and I emphasize fewer because this isn't a floor, it is a ceiling. I strongly discourage Virginians from having social events with that many people, especially indoors. It's just too dangerous, and you increase the risk of spreading this disease. We know that one factor in the increased spread is small gatherings in people's homes. I know this is really hard with Thanksgiving coming up, but that isn't the best idea. While socializing virtually is the safest way right now, if you must get together with people outside your household, do it outside if you can. Under the new rules, restaurants must stop serving alcohol at 10 p.m. and close their dining rooms at midnight. While the virus can certainly spread at restaurants before 10, we know that the later the event gets, the more likely people are to drink and forget about social distancing. Children age 5 and up are now required to wear face coverings in public, including in our schools. This aligns with recent CDC guidance. Virginia has had a mask requirement since May, and we all need to remember that. The science shows us that wearing masks reduces the spread of the virus and can protect the person wearing the mask. This is such an easy thing we can do to help care for other people, so please wear a mask. We are strengthening enforcement of existing statewide guidelines. Businesses must follow the guidelines for physical distancing, face coverings, and enhanced cleaning. For some establishments, these had been a best practice. Now violations will be enforceable through the Virginia Department of Health. Spectators at recreational sporting events will be limited, as will entertainment venues and racetracks. Other states are implementing similar measures. Yesterday, the Navy put limits on travel and activities for sailors in the Mid-Atlantic region, including those right here in Hampton Roads. We know that these measures work. Back during the summer, when cases surged in Hampton Roads, we implemented similar mitigation measures there, and we saw case counts go back down. It can work again, but we all need to follow the rules. I know that everyone is tired of this pandemic. We've been doing this now for 8 months, and it is stressful and it is exhausting on all of us. But you have done a great job, Virginia. We have some of the lowest rates in the nation, and that is because of each and every Virginian who wears a mask, who stays at home, who understands that this is about our responsibilities to one another. A vaccine is in sight, and while that will take time to distribute and take effect, I hope that just a few months from now we may be past the worst of this. So let's not make this winter any worse than it has to be. Be smart, be careful, and think of those around you. Now I'd like to turn to our state budget. The General Assembly recently ended its special session and sent me a budget bill. Today, I have signed that budget. I think it's a great budget for Virginia. It is very progressive, and it includes provisions to protect Virginians from evictions and utility shutoffs. We continue to take further actions to support our frontline workers and protect taxpayer dollars. Earlier this year, the federal government authorized Title 32 status for the National Guard, which meant the federal government is paying for this assistance. This week, I have asked the federal government to please extend our Title 32 status through next year at 100% of the funding. Throughout this pandemic, our Virginia National Guard has been a critical partner, helping move supplies and especially helping provide manpower and logistics for testing events. So on behalf of Virginia, I thank and I encourage you, if you get the opportunity, to thank these men and women who are right now serving our Commonwealth and serving this country. I want to turn now to our small businesses, like restaurants, fitness businesses, and local stores. I've said many times, we have both a health crisis and an economic crisis, and we are focused on both of them. I know our small businesses continue to struggle and face very real, very difficult pressures. You don't know when customers will come back. You struggle to keep your employees safe, and you don't know what is going to happen or when all of this is going to be over. So I know it's impossible to plan for the future. We are working to provide some support and assistance to businesses through the Rebuild Virginia plan. A few weeks ago, we expanded the eligibility for this grant program and put additional money into it. I'm pleased to say that this funding is going to go out the door to help businesses. We've received nearly 15,000 applications and so far have approved more than $55 million in grant payments. Almost 39% of that has gone to businesses in low-income communities. But I know that everyone from laid-off workers to businesses continues to struggle. We are encouraging Congress to pass another stimulus package. I've been in touch with members of our congressional delegation just this week about this. Now that the election is behind us, and I think everybody is pleased about that it's behind us, Congress needs to come together to get this done, and they need to get it done now. The sooner, the better. Finally, as we get into colder weather, I want to remind everyone to get a flu shot. It's a simple and easy way to protect yourself and those around you. We don't want you or our hospitals dealing with the flu while also fighting COVID. I'd also urge Virginians to please donate blood if you can. The Red Cross is always in need of blood donations, and it has not been able to conduct some of the large blood drives it typically relies on. You can find out more at redcross.org. Today, we are 9 days from Thanksgiving. And while 2020 has been a very tough and challenging year, and those challenges are not over, we can be grateful for where we are and how far we have come together. But I ask you, Virginia, to think hard about how you celebrate this holiday. Consider the risks, not just to yourself, but to your family and to your loved ones. We all want to be together to have our traditions, to celebrate something with people that we deeply care about. I know there have been few enough celebrations this year. We think of Thanksgiving as a time of family and of love, and maybe some football. But this year, staying home is an act of love too. Protecting the people you care about, protecting your neighbors and community, even protecting strangers is an act of love. So please think about your holiday plans and the risk. Eat outside if you can. Have a smaller gathering. Hold a virtual Thanksgiving. Zoom is making it easier for people to get online for Thanksgiving by lifting its time limits for this purpose, and that's great. Do your Black Friday shopping online. College students need to be very careful and thoughtful about how and whether to go home for the holiday. Follow your institution's guidance. Be kind, please, to the retail workers, the grocery workers, the essential staff, and especially our healthcare workers. If you feel sick, please stay home. If you think you need a test, get a test, and stay home while you wait for the results. And do what we all know works. You've heard me say this a number of times. Please wash your hands, wear a mask, avoid large gatherings, and download COVIDwise, our health department's app that will notify you if you've potentially been exposed to someone who tested positive. So let's all act together to make sure that next year, everybody that we love is at that Thanksgiving table. Now I'll turn it over to our Virginia Health Commissioner, Dr. Norm Oliver, and then we will be glad to take your questions. Thank you.
Dr. Oliver. Thank you, Governor. Good afternoon. As the Governor mentioned, cases that were reported yesterday are 2,071. Cases have been increasing steadily over the last period. You saw that graph in the Governor's presentation. Our case incidence rate was about a month ago around 9 cases per 100,000 population. We're now double that. We're approaching 20 cases per 100,000. The total number of cases have hit 208,833. The Governor mentioned that we had 25 deaths reported yesterday, and that brings the total death count to 3,860 people. We have been doing quite a lot of testing. Our average testing is around 20,000 tests per day. We have a total now of 3,229,178 PCR tests. Yesterday, we posted another 20,273 tests. I think I'll leave it at that. The Governor made, I think, quite a impassioned and very on-point remarks regarding what we need to do to get a handle on stopping the spread of COVID-19, and I hope everyone takes his words seriously.